We have to keep talking about the hepatitis B vaccine and why it's important for newborns. Hi, I'm Internal Med Doctor Board Certified Physician, and I'm going to explain to you from a numbers standpoint, in very basic terms, why this is such a bad idea. And it's really surprising that RFK and his CDC ACIP people don't really understand population health and what happens when you change a policy like this. First of all, before this policy came into play, 20,000 kids a year were getting hepatitis B. Now that's down to like less than 20. That's a really successful project, right? So now let's play this out with numbers. Let's say you've got a small country that has about 1,000 live births annually, and we've been giving the hepatitis B vaccine consistently. Like 999 out of 1,000 of those kids get the hepatitis B vaccine when they're born. Now, let's say we institute this new policy where you can not get it, you can choose to delay, you can talk to your doctors later. So let's just say 10% of the folks take RFK's offer up and say, you know what, we're not going to give the vaccine to our newborns. We're just going to wait to talk to the pediatrician when we're 2 years old or so forth. So now you've got 100 kids that have left the hospital that did not get the hepatitis B vaccine. A percentage of those kids maybe will go show up at their pediatrician when they're 2 years old and get the hepatitis B vaccine. But the reality is of those 100 kids, a bunch of them are not going to get the hepatitis B vaccine, partly because they forget or partly because their parents are anti-vaxxers and they're just going to continue to insist that their kids never get it. So instead of one kid leaving the hospital without the hepatitis B vaccine in this country that year, 100 leave and then they grow up. And of course, in their 20s and 30s, they may get hepatitis B from a variety of different ways that you get hepatitis B. People don't realize the hepatitis B vaccine is very protective for up to 20, 30 years. So of those 80 or 90 kids that never got the hepatitis B vaccine at their pediatrician when they're 2 years old, a bunch of them are going to get hepatitis B, not all of them, some of them, and then they're going to have complications from hepatitis B, and some of them may get cirrhosis, some of them even get liver cancer, some of them may get acute fulminant hepatitis and require liver transplant. Now remember, this country is only 1,000 live births a year. We have over 3.5 million live births a year in the United States annually. So imagine 10%, 350,000 kids a year decline to get the hepatitis B vaccine, and they age, they become 5, 10, 15, 20 years old, and a bunch of them never get the hepatitis B vaccine. You can be darn sure of those 350,000 kids that left the hospital that year are going to get hepatitis B at some point in their life, a bunch of them. And furthermore, this is just 1 year we're talking about. 1 year, 350,000 kids, 10% of the annual live births declining the hepatitis B vaccine. Every year, 10% are going to decline it, right? And that population of kids and eventually teenagers and young adults that never got the hepatitis B vaccine continues to grow and grow and grow every year. And then hepatitis B starts spreading in those populations of hundreds of thousands and millions of people that never got the vaccine when they were newborns. And I'm just assuming 10% of the people decline the vaccine. It could be 15%, it could be 20%. The anti-vax movement has gotten so far into people's heads that I wouldn't be surprised if 20% decline. So now imagine 500,000 to 1 million children a year not getting the hepatitis B vaccine.